All right. So today we're going to be doing a little Graston treatment on our patient here today. We're going to be working on upper back and shoulders. And today I'm just trying to get you an idea of what Graston treatment looks like and what to expect from a treatment. So what Graston is used for is to help break up adhesions in the muscles and help loosen up tight tissue. So today I'll show you just a brief description of how to do it, and then we'll kind of go from there. So this first tool that I'm using is what we call a scanning technique. And while we're doing the scanning technique, what we're looking for is just some redness that might be coming up to the surface. And what that is just a little bit of extra blood flow coming to the surface. But then what else we're looking for is a little bit more of these little darker reddish tissue that might come through. And you can see here that there's a couple different color of redness that's coming through. And the darker redness is going to be more the spots that we're going to be targeting. That tells me that there's some muscle adhesions possibly, or some scar tissue that might be bound up in the area. So we scan here with this tool first, and then once we have a good idea of where these adhesions are or where these trouble spots are, is when we'll move up to this next tool. And what this next tool will do is give us the ability to get a little bit deeper and focus specific on points that have some troubles. And once we find those troubled areas, what normally will happen is we'll find some little red dots that may come to the surface. And what these red dots are is called petechia. And what this petechia is normally a buildup of blood that is caused, that is stuck in adhesions in a muscle tissue, in a muscle belly, or in the fascia that may be attached to the muscle. We want to break up these adhesions, and that will in turn help loosen up this muscle. So the reason why we'd use Graston treatment is for normally for musculoskeletal injuries that that happen in the shoulders, back, neck, hips, anywhere that you may have problems with a muscular tissue. And as you can see here, there are some red spots of that petechia that's coming through, and those are some things that you can expect from a Graston treatment.